Okay. Right. For me, I think being on the inside of the pandemic, being a frontline health worker battling the disease in a country that doesn't have enough resources has been quite a frustrating journey. And since the second wave, I think this started this January for Malawi. Since the second wave, we have lost one healthcare worker to the pandemic just a few weeks ago, and she was a nurse, I think, who was working quite closely with the COVID-19 technical lead team. So she helped us, I think, train all the healthcare workers across the district, and I think this was one of the cases that I managed quite closely. And I think I do remember going into depression because what had happened with her death ideally was we it hit us the first week of the second wave, and we didn't have any way to put her, even as a frontline healthcare worker. I think we had one tent with a two-bed capacity, so we improvised one of the wards to keep her in the ward. But in that ward, I think we needed 100% oxygen, and at the time we didn't even have the 100% oxygen. She wasn't doing fine on her oxygen concentrator. We didn't have the medication that she needed because I think when she deteriorated, we had been treating her for with antibacterials for the pneumonia, and we had been treating her. She had a past history of asthma, so we had been treating her with, I think, medications to assist her asthma, and we started suspecting that maybe she might have had a pulmonary embolism. So she she ideally needed anticoagulants, and we didn't have any. We asked everybody we could, every hospital that was there in Kasungu. So the next thing that we had to do was to refer her to Kasungu, I mean to Lilongwe, which is about 2 hours. So we started off with only maybe a quarter tank of oxygen that was in supply, but she deteriorated within like 15 minutes of the journey, and she passed on along the way. So this is just an example that I can give of the struggles and the complications that we've had to live with, we've had to deal with, because we have the capacity to help these patients, but we don't have enough medical drugs or supplies to optimize the care for our patients. So it's been a horror, being on this end of the battle, being on this end of the war of COVID-19. And we've really struggled, and this is just one of the situations that I think personally, as a doctor, I think was quite horrid, and it was enough to put me in depression. But every day we have to wake up, and every day we have to fight, because these are lives of people that we're supporting.
Mm.